Hello, my name is Priscilla Heaney, and I did my internship for Center for Awareness Promotion. The mission of Center for Awareness Promotion is basically to promote, support, and affirm healthy living behaviors among campus community members to foster knowledge, attitudes, and skills that are essential for decision making and enhancements of self-esteem. It was based on the campus, and like most of the health education programs were like direct care consultations and referrals. So the internship that I had to do was basically it provided me with practical experience in public health that relates to assessments of individual and community needs for health education, for planning effective health education programs, implementing health education programs, evaluating of effectiveness of health education programs, provision of health educator service coordination, acting as a resource person in health education, communicating health and health education needs and information. So basically, when I started my internship, all I had to do was plan, develop, promote health and awareness programs and materials. So I started this in the beginning of January. So when I started, it was a little bit cold, and initially, what we wanted to do was substance abuse. So she basically divided all of us in groups, and she was like, okay, this is like the flu season had just started. So she was like, okay, this is flu season, but we also like we're having a lot of our students deal with substance abuse. So should we do both and incorporate and stuff like that? So she had it was seven of us. She had us just pick like raffle, substance abuse, and flu. So we basically picked, and I ended up picking flu. So all I had to do was like plan and promote, develop. So first we had to create a strategy plan. So first I had to create a survey pertaining to like code and stuff. So before that I had to do the research of like how is like the flu transmitted, like how easy is it for us to get sick from the flu. So first I had to do background research. In terms of research, I did a lot of research on, first I started with surveys, creating surveys with hand washing, because I think most of the time we pass simply like we touch everything. Most people even sometimes sneeze, they sneeze in their hands, they sneeze right here, and these are the stuff that we touch doorknobs with, and we tend to not to wash our hands a lot. So I incorporated a couple of questions, and I printed out about 100 copies, and I just went around distributing it, not to just be the people on campus, but to where I work, my housemates, my family and stuff. And based on that, I was able to get all the information back to write my research paper on. Like, I've noticed like a lot of people did not wash their hands, that contribute to them like being sick. And also we also had the issue of people thinking, oh, if I'm going to get the flu, what's the whole point of getting a vaccination for it? Like, so basically the whole point of it was just I gained a lot of experience in like evaluating the prevention of flu through like social media messages, publication materials, and a lot of programs. And also I had to translate all the data I've gotten back from the survey into like information suitable for like the college students and like middle, my parents, anybody else that's older, so they be able to get the facts and articles. And by doing that too, I had also, because we were doing mostly with college students, and mostly college students are used to social media. So that meant I had to post messages on the Center for Wellness program social media. That means I had to be posting on Instagram, Facebook, and Twitter, just basically talking about flu and like just washing your hands. Like it was like subtle tweets like, remember to wash your hands, you're passing germs. Like I had to create like a lot of posters and find like little things that were relatable to them. And also we also had a health advocacy and research grant opportunities. And basically after we're done with all the research, we had to develop content on like health topic for their website. So we created a little poster on hand washing and just preventing the flu. And after that, the next step for me now is going to try to convince people to take the flu shot. Because most of them in the survey questions, we realized that they were not washing their hands, and they were also not concerned about taking the flu because they had that mindset like, oh, if I take the flu shot, I'm going to get sick regardless. I think this internship was a good opportunity for me because I was able to develop like leadership skills, and I was able to also explore my interests in health education and promotion. I was able to market very well, which I didn't think I was good at marketing. And I did a lot of program planning, implementing, and evaluating. And I loved the fact that it gave me the practical experience in public health and education and promotion while being under the supervision of a staff member. And most of it, we conducted like regular meetings where we were able to share our experience and make sure like we were actually like having a meaningful work experience. Most of my work consisted of me usually sitting at the desk after like I had collected all the data. And that, I think for me, that was the most difficult part because to now I had to like process all the information and figure out what my next step was. So I think I struggled in that part, but I thank goodness my mentor, she was willing to help me. And she's like she asks like, oh, she always checked on like, do you need any more help? How's the server going? How's the data collecting going? So I think this internship was really good because I got to like get a sense of how to collect data and interpret it and like try to convey a good messages for like future students or like just anything. And just being in that setting and is different. I actually really enjoyed it. I was hoping because I'm gonna continue. I have not basically I'm done with my hours needed, but I'm not done with them because I have a conference coming up with them that I'm excited to go with them. So I won't be done with them till like August. So hopefully I'm just trying to see if it's possible to like actually land my footing in there and hopefully get a job with them. If anything, just even if it's on the research side, if I'm going to be like a health communicator, just doing a lot of research and being able to talk to students for more, because I know their next lesson is usually on substance abuse. That's like their number one big problem. And I kind of wanted to work on that, but I was glad I got to work on flu prevention. It was really good, and it made me realize like even I don't wash my hands as long as I should too, even if I was the one doing it. So it just gave me a lot of like strong written and oral communication skills, and it sparked up my interest in healthcare, and it made me very organized. I became detail oriented, and I've noticed I was very good at working independent, and I didn't even know I was really good at editing and social media because I'm not really a social media person myself. But I'm so grateful for this opportunity because I got to experience and advance on my set skills. So that's pretty much what I did. Thank you.